you all these statements in 2023. One was providing details the medical provider for Nandi County staff for financial year 2017-2018 to date. State the criteria of the work process on the current provider, explaining the role of Amana Insurance, who are paid 195 million, yet Britam is the insurance provider. And then another provide the policy document for Nandi County Executive stating staff, indicating the number of staff, dependents, and all the benefits such as inpatient, outpatient, dental, and optical, including hospital, panel, and doctors. Disclose whether any other medical insurance covers for the entire staff of the county other than NHIF. And remember, the Nandi County's staff is 4,333. Provide the total sum of compensation paid out for medical cover for the financial year 2017-2018 to date. That is around 5, 6, 7 years. And both of these statements were raised in the last year up to now. The governor has conveniently avoided to appear before the Senate. And we were expecting him today. The first invitation went out early this year. He was supposed to appear before 12th of March. He avoided it and requested to appear on 25th April 2024 to tell us the status of health in Nandi County. So he skipped and avoided of appearing. Then on 25th April 2024, he was also scheduled to appear on Thursday, 2nd May 2024. He did appear on 25th April, so he was supposed to appear on 2nd May 2024 as from 10. So he has requested for deferring more than now 4 times. Today he was scheduled to appear before the Senate Committee on Health at 9. I'm aware that there was a scheduled Kenya Up and Support program today, but that meeting was supposed to begin at 11:30. It was in the indulgence of the committee that the governor appears 9, and I was in the committee room and the members of the Senate by 8:30, so that we would have used 1.5 hours to try and dispense and understand the schedule or the status of health in Nandi, which continues to deteriorate by lack of drugs in the county hospitals, incomplete infrastructure from Kapsabet New Mother and Baby Hospital, Kaukobujoi, which is stalled, Kapsengere, which is stalled project, and Chepterwai Nyayo Hospital, which is stalled. And of course Kabiet, where there are no drugs. And of course, to understand, out of 113 dispensaries, or more than that, out of 133 dispensaries, why, for example, Samoget does not function and it does not have drugs? Why 14 health centers and 115 community health? Those are the issues that we should have seen. And even another issue was why the casuals were fired that work, and yet there are more than 4,333 workers in Nandi County. So the governor conveniently avoided. He has been avoiding for the last 4 appearances. Conveniently, he has every reason to try and not tell the country or the people of Nandi why there is poor state of health in Nandi County. And we were ready to prosecute the matters as per before man and God. But unfortunately, and you know, these matters has been captured by the Auditor General report and many others. But the gist was about the status of health, including medical cover of the staff. And we are discussing here about close to a number of Let me get you the number. We are discussing more than 340 million of staff insurance medical cover of Nandi County. So, and it is usual, the governor has been avoiding. These are evidence of letters that has been written by the Senate to him to appear, more than 4 invitations. The committee even went ahead and ensured, the Senate decided to hold meeting even at 8, 9 to ensure that if there was another meeting or other engagements that the governor had, and I've seen the letter that he has written to the committee or to the Senate to indicate, and you know when you are rescheduling a meeting that everybody was waiting, not only the Senate but the people of Nandi, to know the status of health. MAQ, Nandi, and I have evidence of controller of budget here. I received this letter from controller of budget on 23rd April 2024. MAQ, Nandi County, because the people really wanted to know what is the status of health. There is no drugs, the staff are demotivated, the infrastructure is torn, among other things. The money that has come to Nandi County continues to be a lot of money. And here it is written, as of 17 April 2024, total requisition amount of 5.4 billion from 124 requisitions has been dispersed to Nandi County. So up to 17 April 2024, on the financial year of 2023-2024, Nandi has received 5.4 billion Kenya shillings to the county government of Nandi. And therefore the money is there. So the governor was supposed to appear and tell the people of Nandi, where is the service? Money has been dispersed. There is an evidence of the same. This is the document from Controller of Budget. This is the document of Controller of Budget. It is not my document. It indicates that Nandi from, in fact, let me get the, from Monday 7 August 2023 to 17 April 2024, Nandi has received 5.43 billion Kenya shillings. MAQ, this money should see the value of money, and that is why the governor must have come and told us what is the status of health in Nandi, because at the moment it is deplorable. And somebody has been saying, even I have another evidence of the previous financial year, that is the year 2022-2023, Nandi received over 7 billion, and it is here, it is written, in 2022-2023, on equitable shareable revenue. This is not on source revenue. The taxes watu wanalipa katika kaunti ya Nandi ijawekwa hapa. So ni zaidi ya bilioni 7 was been paid to Nandi. And you can see even, so these are documentation from the Office of the Controller of Budget that should have been given reason as to why this accountability shall be made. So I have appealed to the Committee of Health to follow up and ensure, and I remember Governor Cherargei yesterday even did not attend, because as Parliament, there are always 2 important things, cabinet meetings and Parliament. Even Governor Cherargei yesterday did not attend IBEC, the Intergovernmental Economic Budget Forum hosted by the Deputy President, because he was appearing before Senate Public Accounts. There was no reason whatsoever. The reason that is given by a governor is just chickened out, attacking to account for the resources that he has been given to the county of Nandi. This money does not belong to him. It belongs to the great people of Nandi. But I want to assure, kwa sababu kulikuwa na watu wengi who are waiting for this engagement to know the value of their taxes, the money they pay in tax that is remitted to the county for development and for service provision. I know many people are waiting for this meeting, but I want to assure everybody who is watching and following that whether he runs, he cannot hide. he must appear before the Senate and tell the Republic, because this accountability is about transparency, accountability, but they say the guilty are always afraid. If he really wanted to, why would he not want to account to the people of Nandi who gave him opportunity to serve them? So the point na hiyo tutahakikisha hata atoroke, ajifiche wapi, atafute vijisababu ambazo ameandika kwa mabarua. I can assure you that he will not run forever, but he must be accounted. Whether he escapes today, he doesn't want to appear today before the Senate, giving flimsy reasons, yet he doesn't want to account for money. Na committee ilikuwa imempatia nafasi, wakamwambia kuja saa 2 saa 3 ni sali moja ama 1 hour, then haende shughuli zake. Jambo ambalo ni kubwa tu, account for, atuonyeshe pesa ambazo zimepea katika kaunti ya Nandi kuanzia mwezi wa 8 mwaka jana mpaka tarehe 17 mwezi wa 4 mwaka huu. Nandi ilikuwa imepata zaidi ya bilioni 5 nukta sijui kwa Kiswahili wanasema nukta 4-3. Na hiyo ndio tunataka tu atuambie, hii pesa zote zinaenda kaunti ya Nandi, mbona hakuna madawa kwa hospitali zetu? Zaidi ya dispensary 333. Ukienda pale Samoget, Kemolo, Maraba hakuna madawa. Uende kama hospitali zingine dispensary hapo Tamboya dispensary hakuna madawa. Ukienda katika hospitali kuu ya County Referral Hospital hakuna huduma, hakuna madawa. Ukienda katika hospitali ya Chepterway haijakamilika, ya Kobucha haijakamilika, ya Kapsengere haijakamilika, na zile dispensary zaidi ya 130 na zile 6 sub county hospitals. Ukienda katika Maraba, uende katika Nandi sub county hospital, uende katika Kaptumo sub county hospital. Hizo ndio maswali tulitaka kujua, kwa sababu nikienda katika kaunti ya Nandi kila wakati wanauliza swali ni kwa nini atuoni huduma. Mimi kama senator kila weekend nikienda katika hafla mbalimbali, katika kanisa, katika misikiti, wanauliza pesa ambazo zinatoka Nairobi ambao kaunti ya Nandi inapokea, atuoni huduma. Ukiona barabara hakuna, mahospitali ndio hiyo, basari ndio hiyo, na zile changamoto ambazo watu wengi wanapitia. Umeona tuko na wafanyikazi 4333 na kuna wafanyikazi ambao walikuwa casuals katika hospital zetu, wale wanaitwa cleaners, wale wanaitwa support staff, walifutwa, hawajarudishwa kazi. So ukiona katika mahospitali mengi hakuna watchman, hakuna wale support staff ambao wanaweza saidia zile dispensary zetu na mahospitali zetu. So mimi nilitaka tu niwajulishe wale wakaaji wa kaunti ya Nandi na Wakenya. Najua wengi walitaka kufuatilia mkutano huu, lakini kwa sababu ya governor ambaye kila wakati anatafuta vijisababu, kuna makaratasi kadhaa zialiandikwa za barua za kumwalika mikutano. Hii ni mkutano wa sasa wa 5 anaepa kuja kujadili hali ya afya katika kaunti ya Nandi. So nawatakia kila laheri. Nataka niwaulize Wakenya wote mahali mlipo, tafadhali tukue waangalifu katika mito, kwa sababu unajua maji na hii mvua inapoendelea kutakuwa na mfuriko katika sehemu mbalimbali za taifa letu la Kenya. Nataka niwaulize Wakenya wote mahali walipo, tafadhali ukiambiwa barabara imefungwa ama kuna maji imefurika, tafadhali tujaribu kutotumia zile barabara ambazo zimefungwa na serikali na zile ambazo zimewekwa katika hali ya tahadhari ya mafuriko. Na nataka niulize wakulima, tafadhali turudi mashambani, tuendelee kulima, kwa sababu baada ya mvua sisi hasa katika kaunti ya Nandi na zile kaunti ambazo kilimo ni kipaumbele, tunaweza kuzalisha chakula ya kutosha katika taifa letu la Kenya na kukidhi mahitaji. Asanteni sana. I want to wish you a blessed day. God bless you. From 2:30 you can catch us up at 2:30 at the plenary of the Senate. Asanteni sana and God bless you. Have a good